Another day, another video of first aid by a comprehensive guide, Ibuprofen and Tylenol for a fever, first aid by. This video is designed to provide a comprehensive overview of the use of ibuprofen and Tylenol for treating a fever. We will discuss the potential benefits and risks associated with each, as well as provide guidance on when to use one over the other. The information provided here can help you make an informed decision about which medication will best serve your needs. When you have a fever, it can be difficult to know which medication to take to bring down your temperature and relieve your symptoms. Two of the most common over-the-counter medications used for fever relief are ibuprofen, Advil, Motrin, and acetaminophen, Tylenol. Here is a comprehensive guide to help you choose between the two. Know the difference between ibuprofen and acetaminophen. Ibuprofen and acetaminophen, also known as Tylenol, are two of the most commonly used medications for treating a fever. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, and acetaminophen is an analgesic or pain reliever. Ibuprofen is most effective for reducing inflammation and pain, while acetaminophen is best for relieving fever and body aches. It is important to know the difference between these two medications and not exceed the recommended dosage, as they can both have serious side effects if taken in large amounts. Ibuprofen is generally considered the preferred treatment for fever, but it is important to follow the advice of a doctor before taking any medication. Consider your symptoms. Ibuprofen or Tylenol can be effective treatments for a fever. Before taking either, consider your symptoms. Ibuprofen can be especially effective for reducing inflammation and relieving pain associated with a fever. It is recommended that you take the lowest dose necessary to reduce fever and that you drink plenty of fluids when taking ibuprofen. Tylenol is also a great choice for relieving fever and reducing discomfort. It is important to follow the recommended dosage and to not exceed the maximum daily dose. Be sure to carefully read the instructions, warnings, and precautions before taking either medication. Be aware of potential side effects. Ibuprofen and Tylenol are both over-the-counter medications commonly used to treat fever. While these medications can be effective in helping to reduce fever, they may also have some potential side effects. Ibuprofen can cause stomach ulcers, bleeding, kidney issues, and other long-term health risks when taken in large doses or over a long period of time. Tylenol can cause liver damage, especially when taken in large doses or for an extended period. It is important to always follow the instructions on the label and to consult a doctor if you experience any side effects. Additionally, do not use ibuprofen or Tylenol to treat a fever in children under the age of 6. Know the recommended dosages. Ibuprofen and Tylenol are two of the most commonly used medications for treating a fever. Ibuprofen is a non-steroidal anti-inflammatory drug, while Tylenol is acetaminophen. Both can be used to reduce fever, but it is important to note that they have different recommended dosages depending on the severity of the fever and the age of the patient. For adults, the recommended dosage of ibuprofen is 400 to 800 mg every 4 to 6 hours, while the recommended dosage of Tylenol is 325 to 650 mg every 4 to 6 hours. It is important to follow the recommended dosage for each medication to avoid any adverse side effects. Talk to your doctor or pharmacist. Ibuprofen and Tylenol are two common medications used to treat fever. Ibuprofen is an anti-inflammatory medication and is available over the counter in a variety of strengths. It works by reducing inflammation and fever in the body. Tylenol is another over-the-counter medication for fever and is available in both regular and extra-strength doses. It works by reducing the amount of a chemical called prostaglandin in the body, which reduces fever. Both medications can be used to reduce a fever, but it is important to talk to your doctor or pharmacist to determine which one is right for you. Consider your age. When it comes to treating a fever, it is important to consider your age. For adults, ibuprofen is typically a safe and effective option. Ibuprofen helps to reduce inflammation and fever by blocking certain enzymes in the body. However, ibuprofen can be dangerous for young children, so it is recommended to use Tylenol instead. Tylenol is a fever reducer that does not contain ibuprofen, which is why it is a safer choice for young children. If you are unsure of which medication to use, always consult your doctor or pharmacist for advice. Consider other medications. Ibuprofen and Tylenol are common over-the-counter medications used to reduce fever. While these medications can be effective for some, it is important to consider other medications for fever as well. Medications like aspirin and acetaminophen can be used to reduce fever and may be more effective for certain individuals. It is also important to remember that medications like ibuprofen and Tylenol can have side effects, so it is best to consult your doctor before taking any medications. Monitor your symptoms. Ibuprofen and Tylenol are widely used over-the-counter medications for treating a fever. When taking either medication, it is important to monitor your symptoms and ensure that the fever is decreasing. If the fever persists after taking the medication, contact your doctor for further instructions. Take ibuprofen and Tylenol as directed and avoid exceeding the recommended dosage. If you experience any adverse side effects, stop taking the medication and seek medical attention. Consider the duration of action. Ibuprofen and Tylenol are both effective at reducing fever, but they have different durations of action. Ibuprofen can provide relief for up to 8 hours, whereas Tylenol typically starts to wear off after 4 to 6 hours. It is important to consider the duration of action when selecting an over-the-counter fever reducer. Depending on how long you need relief, one or the other may be more appropriate. It is also important to speak to a doctor if a fever persists for more than 3 days. Check the labels. Ibuprofen and Tylenol are two popular over-the-counter medications used to treat fever. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, that works by reducing inflammation, while Tylenol is acetaminophen that works by reducing the body's responses to pain and fever. Both medications can be useful for treating fever, but it is important to check the labels and use the right dose for your age and weight. Ibuprofen should not be taken by anyone under 6 months of age, and Tylenol should not be taken by anyone under 2 years of age. Additionally, it is important to speak to your doctor before taking either medication if you have any underlying medical conditions or if you are pregnant. Conclusion. In conclusion, choosing between ibuprofen and acetaminophen for a fever depends on several factors, including your symptoms, age, and medical history. Always follow the recommended dosages and seek medical advice if you have any concerns or questions. Remember to monitor your symptoms closely and seek medical attention if your fever persists or gets worse. Thanks for watching.